Hello everyone, and thanks for joining this outcome-driven innovation session. Let's see how to overcome MR compromise with artificial intelligence. This is the agenda we will follow during this presentation. Let's see what challenges MR departments are facing in 2022. There is a focus to increase the throughput while maintaining a high clinical confidence, and increase the throughput because everybody has to catch up with a higher backlog of patients, and especially after COVID. Also, some extra time is needed for cleaning and disinfection, and there is a main objective to try to shorten the examination procedure. But in the meantime, nobody is willing to make any compromise in clinical confidence. We want to secure the clinical confidence with high-SNR and high-resolution images, and the solution has to come independently from the number of channels or kind of coils or anatomy or scan parameters setting. First, let's review the usual trade-off in MR. And you know about signal-to-noise ratio. The target is to have the highest signal and the lowest noise as possible to get the best image quality. And you remember that the signal-to-noise ratio is directly proportional to the voxel size, but also to the signal total sampling time. Looking at spatial resolution, it's all about image clarity for clinical efficiency. If you increase the resolution, you will automatically have an increase of the scan time. And also increasing resolution, achieving high resolution images means a drop of the signal-to-noise ratio. As you can see on this image, very noisy with high level of resolution 0.15 by 0.15 by 1 millimeter with this noisy image, which is not acceptable in a clinical daily practice. And then scan time, it's all about also productivity and throughput, but patient acceptance. And if you are able to reduce the scan time, you will minimize the risk of rescan by increasing the acceptance of the patient in front of MR examination. And if you speed up the scan time, also you will drop the SNR, like the result you see on this 3D flare image in 1 minute and 40 seconds, which is very fast, and you see the image quality is not the high level, and the signal-to-noise ratio is not good enough. So if you want to achieve a high resolution and you expect a short scan time, then you will get a poor level of SNR. Keeping the same expectation for resolution and you increase a bit the scan time, you will be able to recover some SNR, and ideally the objective is to get a full SNR for a good image quality, but it goes through a longer scan time in front of the resolution. This is the challenge in MR, and we have to manage the compromise between expectation for high resolution imaging, high SNR, and faster scan time, and we have a solution to overcome this compromise. Thanks to our global solution around artificial intelligence, AltiVT, we can offer AICE, which is an integrated intelligence solution to see through the noise using a deep learning reconstruction technique in magnetic resonance. Everybody's talking about artificial intelligence or machine learning or deep learning, and there are some big confusion in between the different wording. Artificial intelligence is when system learns from human intelligence. Machine learning, this is based on a pattern recognition. And deep learning, this is where algorithms are using deep neural network. If we look to a typical MR workflow, we start from raw MR data, go through image reconstruction process to generate the final MR image, clinical MR image, and then the radiologists use a special software to analyze, review the images, and generate his report. Where is the place of deep learning reconstruction technique in this typical MR workflow? Most of the companies who operate in AI usually are in between final MR image and post-processing or analyzing or reporting. With AICE, we improve the image quality by deep learning reconstruction using the raw MR data before the reconstruction of the final clinical image for the clinician. So, how to get high image quality in a conventional way? You see this image, T2 weight image, scanned in 1 minute 45 seconds, which is very, very noisy. The scan time was very, very short. The SNR is low. The objective is to try to increase the SNR by increasing the signal. And what are the ways to increase the signal in MR? You can scan on a higher field strength. You can scan with a lower resolution. You can scan with more averages. You can scan with a different coil, more channel or more coil element to try to increase the signal. If you apply more averages, 10 averages, then you get a high quality image, but the scan time is not acceptable. And what is the objective of AICE? It's to increase the SNR, not by increasing the signal, but by lowering the noise. What you achieve and moving from the left image in 1 minute 45 seconds, which is very noisy, you apply AICE processing, and that you get a high image quality on the right in the same scan time, and you achieve a comparable image quality as it would have taken without AICE in 17 minutes. So how it works? If we look to the technique, we are using a deep convolutional neural network. There is a training phase, and during this training phase, we learn the software to differentiate the signal from the noise, and using tons of image with a low SNR. And during the operational phase, the software apply this intelligence during the training phase to remove only the noise from the image, and thanks to this learning phase, to learn the software to differentiate the signal from the noise and remove only the noise. While removing only the noise, if we look at the conventional denoising solution, like a smoothing filter, and we perform the subtraction between the original image and the filter image, then you see that we are in this operation removing some anatomical details, some special information. Doing the same operation of subtraction between an original image and an image processed with AICE, you see the result on the right, and we don't remove any anatomical or special information applying AICE processing. It means we remove only the noise and nothing else. What are the clinical benefits using AICE? You see these two images are from two different acquisitions on the same patient using exactly the same parameter. But one thing was different. The image on the right was scanned on a 3T system, while the one on the left was scanned on a 1.5T system applying AICE. And you can see the image quality is quite the same between the two images. So it means applying AICE on a 1.5T Tesla, we can achieve a similar image quality of a 3T system. Another example with original image on the left, a very small field of view of 8 centimeters, very high resolution, very demanding resolution, very thin slices, very high metric size. And you see when we apply AICE processing on the original data, we get the image on the right with very, very nice image quality. We remove the noise, and we can achieve a very high depiction of the hippocampus with this high resolution. High resolution also for vessel wall imaging, whatever this is in T1 on the left or in T2 on the right. And again, looking for higher resolution, very small pixel size, voxel size with very small thickness of the slice, and very good image quality thanks to AICE. Otherwise, the image would have been very, very noisy and not clinically relevant. This is an example of a full protocol for ankle in a MSK, and the objective was to achieve high resolution for all the acquisition, 5 acquisition, using a very small pixel size, 0.3 by 0.3, and 0.4 for the sagittal T2 star. All acquisitions were scanned in 2D mode, and all acquisitions are with very thin slices, 1.5 millimeter slice thickness, 2 millimeter for the sagittal T2 star. And you see the very nice image quality in a reasonable scan time. And if we zoom the sagittal proton density FATSAT, you can see very nice detail of anatomical detail for cartilage, for example, or some of the ligament. And thanks to AICE, I was able to remove the noise and provide this level of image quality with a high demanding resolution. But scanning the same patient, we can focus not only on high resolution, but on fast imaging. And this is exactly the same protocol. And you see, for sure, the resolution is a little bit smaller, but still very relevant clinically, with a 0.4 by 0.4 or 0.5 by 0.5 with 3 millimeter slice thickness. And all the sequences were scanned under 2 minutes of scanning time, which means an examination below 10 minutes. Another example of a fast imaging, and you remember this 3D flare in 1 minute and 40 seconds. If we apply AICE to the raw data, you get the image quality on the right with a very nice contrast, with a very nice signal-to-noise ratio and a good depiction between white and gray matter in the same scan time. And we can combine both. It means we can achieve high resolution and faster scan time. Comparison for a shoulder, coronal T1 weighted image, original image on the left, and you see we did increase the resolution, moving from 0.5, 0.7, 3 millimeter to 0.3, 0.33 millimeter, and in the meantime we succeeded to reduce the scan time by applying AICE. Similar example in coronal proton density with FATSAT. Again, on the left, the original image, the original, I would say, protocol. And then on the right, the improvement, achieving higher resolution and decreasing the scan time by applying AICE for a much higher image quality, providing a better clinical confidence. AICE is also applicable to 3D imaging. We saw a lot of 2D examples, but we can apply also AICE to 3D flare, 3D T2 FATSAT, or 3D T1 MP range, in this case for the brain. And you see very nice results, very good image quality with a high level of signal-to-noise ratio, but also a very good contrast and good depiction between white and gray matter. AICE is also versatile because we can combine with acceleration technique, and this is one of the benefits. If we start from this sagittal T2 on the lumbar spine, which is a standard protocol with a matrix of 384 square in 2 minutes and 5 seconds, we apply an acceleration technique, which is called in Canon compress speeder with a factor of 4, and we increase also the matrix size to 512 square. And what you get for sure, very fast acquisition, but also a noisy image. And remember, one of the rules for SNR, it's also about the total sampling time. And if you reduce the sampling time, if you increase the acceleration factor, you will decrease your SNR. And the goal is to keep this scan time of 39 seconds, but apply AICE on the raw data, and then you get finally this very nice image quality, very good contrast, providing higher resolution and very, very short scan time compared to the baseline. Another example of combination between AICE and compressed speeder on the cervical spine, or shoulder, or pelvic, with very short scan time, 1 minute or below, which means you can combine both the image quality and the shorter scan time in the objective to increase the throughput and reduce the total MR procedure examination. AICE can be combined also with our acceleration technique applicable to 3D imaging, which is a fast 3D. And you see this example for 3D time of flight, 2 minutes and 24 seconds, 3D MRCP in a breathhold of 20 seconds, and 3D face and lumbar spine with 2 minutes and 48 seconds. Combination to access to resolution, in plane and through plane resolution, but also in shorter scan time to make this acquisition relevant in a clinical daily practice. Another point regarding versatility is regarding the clinical pillar and the kind of acquisition of the kind of sequences we are using. AICE is applicable based on a report from IMV in 2019. AICE is applicable to 96% of all MR procedures, which is very interesting because it means there is space to use AICE almost everywhere in your conventional practice, whatever the anatomies and the sequences you are using regularly. And last but not the least, regarding versatility, AICE is also available across the whole Canon medical system MR product line. Whatever from Vantage LN 1.5T, which is a normal bore system, up to Vantage Centurion 3T dedicated to research, you can have access to AICE for all the system of our product line. As a takeaway, you have to keep in mind AICE intelligently remove the noise from the images and only the noise, and the objective is to improve the clinical confidence in MR. You may have easy access to high resolution images or reduce scan time or both at the same time, and you can get both benefit by applying AICE. AICE is applicable to all anatomies for 2D and 3D scanning modes, and AICE may be applied for 96% of the MR procedure, and again available across the whole MR product line of Canon medical system. Thanks for joining this session. We hope you did enjoy how to overcome MR compromise using artificial intelligence, and feel free to visit our website to know more about our outcome-driven innovation. Thank you and goodbye.